Hello, my friends. Dr. Kazi once again, and today I'm going to talk about not so uncommon problem, but we do often get kids who present with this complaint, and this is what we call as muscular pains. The term used for it is myalgias, and myalgia simply means muscular pains. Kids can present with this symptom, and they can present with muscular pains anywhere in the body. So they can present with muscle pains like pain in the lower back. They can present with pain in the upper back. They can present with pain in their upper limbs. They can present with pain in their one or both thighs. They can present with pain in their legs. So we do often come across these conditions, and today I'm going to tell you about a simple approach how to work up these kids and how to reach a diagnosis. Now, muscular pains or myalgias can be broadly defined into two types: acute myalgias and chronic myalgias. Now, acute myalgia simply mean the muscular pains that are of very recent origin. So usually there is a 2 or 3 day history of muscular pain. Now, it's very important that in all kids who present with muscular pain, which might be confined to one area or it might be a generalized one, you have to see whether there has been any history of trauma or not. Because if there is a history of trauma, then obviously the cause is muscular injury or soft tissue injury, as we call it, and in most of these cases they resolve spontaneously with rest, with analgesia, plus minus some anti-inflammatory drugs. The other common cause of acute myalgias is a febrile illness, and most of these febrile illnesses are viral in nature. So, myalgias is part of the constitutional upset associated with different types of viral conditions. And I don't need to go into the details of which viruses cause them, the list is endless. But nevertheless, you will find it in viruses like influenza, parainfluenza, uh, seasonal common cold viruses, some other viral illnesses. So these are quite common. So if somebody has gotten febrile illness and they have got myalgias, body aches, then obviously you need to treat the underlying condition. And the underlying condition, if it is mostly viral, it's a self-limiting condition, would go in a couple of days. So all they need is rest and painkillers, and to keep themselves well hydrated. Now, the second entity is chronic myalgias, chronic muscular pains. And again, this is a bit of a challenge because most of these kids have got a history of waxing and waning symptoms of pains, which could be localized or which could be generalized in the body. Now, there is a simple approach to chronic myalgias. Number one, please keep in mind the categories which can cause chronic myalgia. So, number one are chronic inflammatory conditions of the joints, which can also present with pain in the muscles as well. So, chronic inflammatory condition of the joints in kids, there is a condition which we call as juvenile idiopathic arthritis, and it's of different types. You can have the post-articular or oligoarticular, you can have the polyarticular type, or you can have the systemic onset, and then there are some other varieties as well. So I'm not going to go into the details of what types of inflammatory arthritis there, but please keep it in mind that if a child has a history of joint pains, which could involve any number of joints and could be anywhere in the body, and with that, if they've got associated muscular pains, then that is the myalgias which are associated with inflammatory condition of the joint. So again, the reasons are inflammation, and the reasons could be immune mediated injury to the muscles or inflammation, as to put it in very simple words. Then there are some other conditions which are again multi-system disorders. They are associated with inflammation in different parts of the body. Usually joints are not involved. Mainly the muscular part of the body is involved, like for example polymyositis or dermatomyositis. So these kids, they have got a history of pain here and there in the body. There might be a history of rash, especially in dermatomyositis, or you might rarely see Gottron papules on the knuckles or on the elbows. But nevertheless, they feel quite rubbish, they feel lethargic, and they have got pains in different parts of the body. The third condition is where there is no inflammation, but there are tender spots in the body, and it hurts a lot. We call it fibromyalgia. And fibromyalgias are sort of some people categorize it as a neuropathic pain, though in fact it has not been proven that it is neuropathic in origin. But nevertheless, the pain is quite real in these children, and they would be complaining of pain. Now, the approach to chronic myalgias is that in all these conditions, you need to look for certain inflammatory markers. So CRP and ESR are quite important, because the CRP and ESR raised, number one, it tells you that it's an inflammatory condition. Number two is that a good screening test is to do ANA. So if ANA is positive, that could mean juvenile idiopathic arthritis, and then you can further work up for these conditions, and they have to be treated with anti-inflammatory drugs. Number three, important step in workup of these children who present with the myalgias is creatine kinase. So if CK is elevated, this usually gets elevated in conditions like polymyositis or dermatomyositis. So it goes more in favor of these inflammatory muscular conditions. And if all these are normal and the child is still having muscular pains here and there, and he's got multiple tender spots, so usually you will see that they are quite sensitive to pain. So if you touch different parts of the body, it would hurt. Like, it could be tender spots in the lower back, it could be tender spots in their neck, it could be tender spots in their limb, and as soon as you touch them, they would be screaming, or they would be crying. And sometimes you wonder that the stimulus is not that severe as the pain score is. So these kids usually have got fibromyalgias, and all the extensive investigations, they come out to be normal. So fibromyalgia is one condition in which all the tests would be normal, and the child still would be having muscular pains. So this in very simple is an approach to muscular pain in children. So as a summary, just keep it in mind that it could be acute or chronic. Acute can be associated with trauma or can be associated with acute viral illnesses, and chronic myalgias could be associated with inflammatory conditions of the joints. It could be associated with the inflammatory conditions of the muscle, or number three, it could be associated with none of these, and that is what we call as fibromyalgias. There are a few other conditions as well, but they are very, very uncommon, quite rare, and I'm not going to go into the details of that. So hope that you can now approach a child who's got acute or chronic myalgias, and you can do a workup and reach a diagnosis. So if you like this short talk, please do subscribe to my channel. Also like the video, share it with your friends, and press the bell icon so whenever I upload a new video, you get an immediate notification. Thank you very much. Have a good day. Bye.